and welcome to Live Life, a Forbes Middle East podcast coming to you from the fourth edition of the Healthcare Leaders Summit. I'm Mishal Al Qasimi, and today joining me is Dr. Mishal Al Qasimi, CEO of Specialized Rehabilitation Hospital and Health Shield Medical Center. Thank you so much for joining us, Dr. Mishal.
Thank you, Lee. Thank you for having me.
Healthcare systems everywhere are trying to shift from reaction to early intervention. From your perspective, what is one practical step that actually moves care towards earlier action?
You know, Lee, that's a great question. And this is a question that's been on the table since the 60s. For us sometimes to understand what's happening today, we need to always look back in history. So the concept of preventive care and preventive medicine is actually as old as Hippocrates. He actually said to some, we have to translate and try to get some of the quote that preventing a disease is better than curing it. But then our current system truly is built in the 19th century. And it was built on reactive medicine. And it makes sense that it was a reactive because a lot of the stuff we were dying of at that time was infectious diseases. And so nobody at that point was thinking about preventive as we do today. And then what we did since the 19th century is just build on this system. So it's the infrastructure is an infrastructure of reactive treatment, reactive medicine. And if you notice, even you, right, even patients today, they still have that reactive thought when they think of healthcare, meaning I'm not sick, I'm not gonna go, I don't need this,
Yes,
I don't
that's very
go.
true.
So it's and you cannot blame people because the system in the industry in all its facets is built to be reactive. Now, in the 1970s, there was a shift in thinking due to one thing. People started having what we call metabolic diseases because we enter modernity, a lot of calories, a lot of foods, people were getting wealthy, lifespan increased, infectious disease didn't become our enemy anymore. Now it's diabetes, cardiovascular diseases, and cancer. So people started playing with the concepts of let's move into preventive medicine. But what we've been doing since the 60s to today is how can I describe this to you, is add to a system that doesn't really match it. Because we got really good with reactive medicine. We know how to measure, we know the insurer, the reimbursement, the policy, we could gauge what did the hospital do or the doctor do, how much it really costs. When it comes to preventive medicine or proactive care, it's a bit complicated. And so we are trying in our current system, but what I'm trying to say, it's truly more of a policy, investment, reimbursement, and culture. The healthcare provider typically follows that. Once those are aligned, and it's not an easy solution, then we go. Now, at our current situation, we are trying our best. So we could say the best things in terms of preventive care is like screening. You do screening based on age, gender, or let's say some symptoms. So an example of the three will be very simple, like colonoscopy at a certain age. Gender will be a mammography. And then at certain conditions, somebody who's overweight, maybe you'll say, okay, you don't wait until they have diabetes or hypertension or hyperlipidemia, you test them. So we are trying to incorporate into the current system, but I really think there needs to be a dogma shift in the entire system in order for us to truly realize and go into true preventive, proactive medicine and not reactive. We have to change the system itself from policymaking to investment to reimbursement to then the provider.
Amazing. Now, you've led the rehabilitation hospital since its construction phase. What do you think is the most underestimated element of building a truly effective rehab and long-term care system, and what impact has it had on Abu Dhabi and the region?
Wow, that's a very loaded question, Leen. So I think the two things that people could underestimate is when you start a project from construction phase to all, is that every phase is different. Every phase requires different talent, different decision making, and different leadership style. And if you don't adapt and change and realize that, you could get in a lot of trouble. So because by background I'm a pediatrician, so I always give it like it's the life stage of a baby. So you have to know when it's crawl, you have to know when it should stand up, when it should stand, and when it should run. And each phase, you need to take care of it differently. So I think what people don't realize is that organization go through this phase. And as a leader, you need to identify it and you need to change how you lead, how you manage. And also the talent around you has to fit this different phase. Now, in terms of impact, I think that is the most gratifying thing for me now looking back after what we did going. It's not, by the way, it's quite emotional and mental load to go through that. But now looking back and see that our people come to us and say, I've been to the US, I've been to Germany, this is better. You guys provide better care. It is culturally within our limit. And at the same time, when it comes to the world-class care, quality, technology, the stuff we use and everything, it's at par with the US, but given it that local feel.
But you've made it accessible to the region.
Accessible,
yes.
and we have data. We've decreased patients going overseas for rehabilitation. And that was our vision from day one, to decrease the socioeconomic burden of our people to seek this kind of care and come to Abu Dhabi. And now we're open to tourism. Now we want this to be also the region to enjoy it as far as the Gulf and even the MENA region.
You've guided large clinical teams through major periods of growth and transformation. What has leading through change taught you about what teams most need in a healthcare setting?
They need guidance and they need a vision and they need support and feel that you're there for them, because these changes are quite stressful for all, not only for the teams, but also for management. But I think what teams like to see is A, that you're with them so that they trust you. And you show that by how you do it, not by talks or emails. And then number two, you have to give them that there is a strategy to move forward. There is a way that we could solve it, but it's not me, it's us. And so they take ownership of also the solution, not only the challenges. And I think that's the most critical part.
At Health Shield, you oversaw its transition into a multi-specialty same-day surgery center. What operational change had the biggest impact on patient experience there?
It's a great question. I think the biggest one is that we say our patient is the center, not of the care, of the world. We see our patient experience as something very sacred, something we value, and it's a job of everyone. We are not physician only focused, that the physician has to do a great job with the patient. It starts from the website, the call center, the front desk, the nurse. Everyone has to see this patient as somebody who's coming to the center seeking care or preventive care.
So it's very human-centered.
Absolutely. With respect, dignity, and to make sure their experience from point A to point C is as welcoming as possible. Because people at the end of the day, they want to feel welcome, they want to feel respected, and they want to feel that you're there for them, not a burden. And that, I think, what we have implemented in Health Shield, and with, of course, with the great team I have, I think we've done a great success in that. And I think that is the real different factor.
Amazing. Thank you so much for joining us here today.
Thank you, Lena. It was my pleasure. Thank you very much for having me.